This is Uncut. I'm Steve Adubato. For the first time on Uncut, she's been with us many times before, but this is the first time on Uncut is Elise Glennon, Executive Director, New Jersey Sharing Network Foundation. Good to see you, my friend.
Great to see you too, Steve.
We're doing this Uncut on the 8th of July. A lot of things happening as we speak. Before we talk about the virtual games, before we talk about September 13th, celebration of life, a whole bunch of things going on, talk about COVID-19 and its impact on organ and tissue donation and transplants.
Well, I'm very happy to report that as of today, as of the last month, all of our New Jersey transplant programs are fully back up and running. Our staff is fully back. Our lab is functioning 24 hours a day, as they always have been, but we are doing all of the testing for the matching between donors and recipients. Our call center hasn't skipped a beat, but there was a period of time there, Steve, that the transplants programs did have to temporarily suspend non-emergency transplant due to COVID-19.
So, we're actually talking to a whole range of physicians, surgeons, people who work closely with the Sharing Network about this. And they were saying that the new protocols, the safety measures in the age of COVID have been critically important to moving forward and making progress. Fair?
Oh, yeah, definitely.
It's so interesting. You don't think through all the ramifications of that, but the clinical experts we've had on have really been great about talking about that. But here's something I want to talk about. So the Transplant Games, last time you were on, Joe Roth, Joe Roth, the CEO, everyone's excited. Jersey Sharing Network, you get the Transplant Games, they're going to be in New Jersey, all over, huge. COVID hits. So confirm when they're happening in 2021. When is that?
We're still calling them the 2020 Transplant Games, just happening next summer in 2021. They will take place July 16th to the 21st. So basically, same week next summer.
Make everyone aware of what's going to happen and why that's so important, because we'll keep plugging it all year. Go ahead.
Yeah, and I appreciate that. We've been plugging it. You've been plugging it for the last 2 years, as all of our partners have been working very hard to make this program happen, and we'll continue to do that, like you said, for the next year. It's going to kick off with a Guinness record attempt for the largest number of living donors in one place. That'll happen at Prudential Center outside on Championship Plaza as we head into the opening ceremony at Prudential. Events then will take place throughout the next 6 days up at American Dream, at NJ Pack, and all over North Jersey at a variety of different venues.
So what's so interesting is as we do this program on the 8th, there are virtual games taking place, and people can go on the New Jersey Sharing Network website, which will be up as I speak right now. They go on the site that we're taping before the virtual games, but you can see them at any point. What will people see there?
So what we wanted to do is we wanted to keep the momentum going, keep people excited to come to New Jersey from all over the country and all over the world. So over the 5-day period, July 20th to 24th, and it'll be all taped and available online, like you said, there's going to be a sneak peek at all of the venues. There will be what we're calling a Zoom of athletes. In the opening ceremony, the real live opening ceremony, we have a parade of athletes. So we're going to do a Zoom of athletes, and you're going to see the different teams and talk about the games. You will be introduced to all of the fun things that New Jersey has to offer, again, in kind of a way to excite people to come here. So there'll be a sneak preview of it all.
I know it sounds like we're doing a lot of plugging, but there are a lot of events. On September 13th, the celebration of life. What is that, and why does that matter so much?
Well, you've been coming for the last 10 years, and I appreciate it. This year is our 10th annual 5K celebration of life. Your typical walk run, but it's really not typical. Our motto is that it's more than a 5K. It's a celebration of life. This year obviously is a little bit different. We can't get everybody together in person, but we will be holding a program on September 13th. We're hoping that there can be some sort of a live component bringing people together. But as everyone's doing with their events, we're monitoring all of the state and federal guidelines on that. But there will be at least a virtual component if we can't get together in person.
The COVID-19 situation has impacted all of us on every level. You're a nonprofit, we're a nonprofit. By the way, to disclose, Elise is on our board of trustees. Also, we've been partnering with the Sharing Network for so many years. The ongoing effort to raise money, to raise awareness, to keep doing what you're doing and giving the gift of life, that doesn't slow down. You have to adapt and adjust to COVID-19, but the mission doesn't slow down.
No, not at all. And I like the way that you said that. Obviously, we're all trying to adapt. You mentioned it before, but our clinical operations, our nurses, our surgical technicians, our lab staff, they still were going into the hospitals. They were, taking all of the various precautions, and their world adapted a little bit for safety reasons, but they were still going out there front lines. Our building, just like hospitals, has the big sign, healthcare heroes work here. And so that didn't change. But you're correct, though, on fundraising and awareness efforts. That really had to change because the majority of what we did was in-person events. So we've moved everything online like you have here. And we're finding that our community still has that motivation, still has that energy to share their story, and get people to get involved, learn more, and register to be an organ donor. And that certainly hasn't stopped.
Before I let you go, remind people how they can register.
They can go to our website, njsharingnetwork.org, and click register to be an organ donor. And may I also, yes.
Go ahead. Hey,
I want to acknowledge our partners in the transplant. Our medical partners are Hackensack Meridian Health and RWJ Barnabas Health. And where I'm sitting right now doing this interview with you is at our other strong partner, the Meadowlands Live Convention and Visitors Bureau. So they've been our partners since the get-go as well.
Absolutely. By the way, I mentioned the driver's license. The driver's license, you still can do what you have to do to make it clear you want to be an organ and tissue donor, right?
You can do that if you go in person at motor vehicle, but if you're going to do anything online, you should do that at our website or on your Apple iPhone in the Health app. You can also click organ donor there.
Elise, whether we're together in person or virtually like this, we'll stand shoulder to shoulder with you. You knew that already. Continuing to get the message out, create more public awareness about the extraordinarily important need for people, not just to know, but to seriously consider giving the gift of life, because there are so many people waiting. Elise, thank you, my friend.
Thank you, Steve. Thanks for having me.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Investors Bank, PSE&G, United Airlines, Johnson & Johnson, the Healthcare Foundation of New Jersey, the Turrell Fund, supporting Right from the Start NJ, the Russell Berry Foundation, the New Jersey Economic Development Authority, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber, and by NorthJersey.com and Local IQ, part of the USA Today network.
Hi, I'm Cecilia Zalkin. It costs much more to care for an infant than for an older child, and many New Jersey child care centers don't have the funding they need. Because of this, many children in New Jersey don't have their basic needs met. Right from the Start NJ is dedicated to supporting this vulnerable population, children from birth to age 3. We know that the early years are the most critical, and we believe that every child deserves a bright beginning and a healthy future.